Well, after more than 6 decades, the Indiana Blood Center is getting a new name and becoming part of a larger network that spans the Midwest. Business of Health reporter Kylie Valletta tells us why leaders say it will benefit the blood supply. Kylie.
That's right, Gary. Thank you very much. The Indiana Blood Center is now Versiti Blood Center of Indiana. Based in Milwaukee, Versiti is bringing 4 other Midwest states under its brand, in addition to Indiana. Now the 5th largest blood provider in the U.S., Versiti says it will better serve Hoosier patients and the 50 hospitals throughout the state that it supplies blood to. Chris Miskell is President and Chief Executive Officer of Versiti and joins me now to tell us more. Thank you for coming to the show.
Yeah, thanks for having me.
So it's important to note Versiti is a nonprofit, just as the Indiana Blood Center was. The Versiti name is new to people in Indiana, so tell us just a little bit about your mission.
Sure. Well, as a nonprofit organization, first and foremost, we're here for the community and for the patients and our healthcare partners that need us to have a sustainable blood supply. So we're focused on that. We talk about blood health innovation, but beyond a stable blood supply, we also do lots of things in science and medicine. And so we like to say that we're focused on all things blood, whether that's research, clinical care, or very complicated specialized diagnostic testing. We're the place to go as it relates to issues with blood.
And one benefit of Indiana joining this bigger organization is sort of this shared strength in treating patients with rare or uncommon needs. Can you talk a little bit about that?
Sure. So imagine a patient that has sickle cell disease and has a very particular need. And in some cases, they may have antigens to blood types that you would otherwise think would be a match. Versiti is invested in genotyping across our 5 states, and so when our donors come in, we genotype them and we have a database that makes it more likely that we can find a need for a very specialized patient that may be suffering from a particular disease.
And you touched on this just a little bit, but Versiti really has a strong background and strength in science and medicine.
That's right. So we couple things. One, we do research out of Milwaukee that from a funding standpoint, we're the #1 funded blood research institution in the United States. And we have roughly 30 NIH funded investigators that are investigating all things blood. And so we take a lot of pride in that, and the connection between research and our folks that provide clinical care really allows us to develop answers for patients. In Milwaukee, we also have a hemophilia treatment center as well as a sickle cell clinic. And so the clinical care really adds to how we can educate those clinicians that are caring for patients around the world.
And you said there's sometimes a misperception that people think you only need blood during times of tragedy, but you need it all the time. And you said it's even getting harder to collect.
The need is constant, and so tragedies tend to bring people out to collect, but the blood on the shelves is what ultimately saves lives every day. In Indiana, we need to collect over 500 units a day to provide for the hospitals that we serve. And I would say that our donor base has been very loyal, but has aged somewhat, and so we're always looking for new and creative ways to bring young donors in their 20s, 30s, and 40s into our mission.
And just a very few seconds left, but if people go out, it's going to look just a little bit different, right?
Right.
Just with the new name on it.
That's right. So it'll be Versiti Blood Center of Indiana. We did that to create a unified brand across our 5 states because we want the folks that we work with to understand the power of all the things we bring to the table. But it's the same local mission and care for our communities.
Very good. Chris, thanks for being here.
Absolutely.
Gary, back to you.